Thank you very much. Thank you for the introduction. I will present the results of the study that we performed in our group at the nephrology department of the university in Timișoara. And it's well that it follows after the previous speech that was also about mortality in hemodialysis patients. And we all know, we are aware of that mortality is high in hemodialysis patients, and this is because many risk factors, some of them traditional risk factors, and I will mention cardiovascular disease, some of them non-traditional risk factors, and I will mention chronic inflammation. And the aim of our study was exactly this. Well, basically it's a part of a larger study, but in this part we looked at some markers of inflammation like CRP and interleukin-6. We looked at features of cardiovascular disease, and we used a rather unusual marker, plasma KIM-1. We had a study group we included from a single hemodialysis center. We included 63 patients that were dialyzed for 1 to 5 years. We excluded those with reduced ejection fraction below 40%. We used the markers that I mentioned, CRP, interleukin-6, plasma KIM-1, and also usual analysis for anemia, serum albumin, and we assessed cardiovascularly the patients with echocardiography. We also had a control group, actually a group of patients with chronic kidney disease, non-dialyzed, with CKD G1 to 5 with a rather high mean GFR of 64 mils per minute. They were age matched. They had similar inflammation, but plasma KIM-1 was significantly higher in the patients on hemodialysis. The mortality of the hemodialysis patients in 4 years were, well, after 2 years was 22%, and after 4 years it was around 50%, 50.7%. And then looking at the factors that were associated with a high mortality, well, of course, inflammation was one of them, and as you can see in the slide, patients with interleukin-6 over a cutoff value of 9.8 had significantly higher mortality. Also, patients with high CRP had significantly higher mortality at 4 years. High ferritin was also influencing mortality. And coming to your question before, Mr. Chairman, of high hemoglobin, we found that hemoglobin over 11 was associated with higher mortality at 4 years, but this is because, and I had no time to present everything, is because of the fourth quartile of hemoglobin. So because of the patients with hemoglobin over 12 that were which had significantly higher mortality than the others. But the real surprise came from plasma KIM-1. Well, plasma KIM-1 showed a statistical significance with anemia, with inflammation, with some features of cardiovascular disease. Well, patients with ventricular hypertrophy had significantly lower, not higher, plasma KIM-1, as it would have been expected. Patients with valvular calcifications had lower plasma KIM-1, but not statistically significant. Regarding mortality, well, lower plasma KIM-1 was associated with significantly higher mortality at 4 years, also because of the first quartile, and it's in the graph there, because of the first quartile, so the patients with very decreased plasma KIM-1 contributed to the high mortality at 4 years. And if you can see here, this pattern was only at 4 years. In the first months, we had a higher mortality in patients with higher plasma KIM-1. Just a few words why we choose plasma KIM-1, because, well, we all know that urinary KIM-1 is a marker of tubular injury. There is data regarding plasma Kim1 that it is associated with progression of chronic kidney disease, and there is a recent meta-analysis in JASN in 2022, where it shows that plasma Kim1 is associated with CKD outcomes, but it's not what is interesting for patients on hemodialysis. What we were interested in was plasma Kim1 as a cardiovascular mortality marker. And there is data in patients with heart failure from the PROTECT study, which shows that high plasma Kim1 is associated with higher mortality in heart failure patients. However, in the ASCEND study, there was no correlation between Kim1 at baseline and mortality. And last but not least, there is a large study comparing 3 cohorts of patients in hemodialysis patients, and here plasma Kim1 stays out compared to other markers like FGF23 or interleukin-6 as a good marker of cardiovascular mortality. And the conclusion that we came to is that, well, plasma Kim1 could be an important or a valuable marker of mortality also in hemodialysis patients. It correlates well with inflammation. It is higher in hemodialysis patients than in non-dialyzed patients. The mortality at 4 years is higher when plasma Kim1 is low, but not at 1 year. So, of course, additional studies are needed to establish the utility of this marker in hemodialysis patients as well. Thank you very much.